Good morning. This is Erin with the Department of Medicaid. It's not quite 9 o'clock and we're still clearing out the waiting room, so we'll give it just a few minutes before we get started.
Thanks, Aaron.
Steve, the waiting room is cleared. It's 9 o'clock. I do only currently see the three TAC
Yeah.
members that are on screen. I
Yeah.
can keep an eye out for more as they come in.
Yeah. I had heard from Christian Porter and Brandon Harley, they both are out. So they won't be there for sure. But
Okay. And Adrian, I believe, declined the invite, so I don't believe she's going to be with us either.
okay. All right. That gets us down to needing 6 of 8, right? So we need 3 more. All
Yes.
right.
Okay. I'll keep an
Um,
eye out.
Appreciate it. Thanks. And Casey Van, thanks for being here. Appreciate it. Um, Obviously, we'll bypass roll call till we have everybody or make a decision. Do not have a quorum, so we won't worry about the minutes. I have a DMS update. I think we have good news. And Angela, you giving that update?
I will. Hi, good morning.
Good morning.
Again, exciting update, but it might be still brief. So again, the department, again, Kentucky as well, also received our approval for the demonstration application as of July 2nd, along with the other cohort of states that we had mentioned over the last couple of months. So that is exciting. Also, not to be alarming, if you all had seen the announcement, the approval is actually only through the end of September, but that doesn't mean it won't be approved beyond that. So just for the logistics of it, again, it will fall under our overarching Team Kentucky 1115. And when that is extended, in the end of September, the additional time frame of the total of 5 years will be rolled up in that. So not to be alarmed, but again, it's just more the logistics and
But it's built into the big 1115 then, right?
It is, yes.
And
And
more
so
stable, I
there,
guess, right?
yes. So the big, yes, big 1115 continues to grow. And so again, I know that it can be confusing, but we do have the overarching Team Kentucky waiver authority. And then under Team Kentucky, we'll have the reentry demonstration. And then again, come September, end of September, 1st of October, anticipate our extension for our SUD, and then we will get the approval for our SMI, our recuperative care pilot, and then again, our former foster care youth for out-of-state coverage that was again existing since our original approval. So there's several components of the overarching Team Kentucky. And again, not to be alarmed that reentry will be fully approved with the extension of Team Kentucky end of September. So with that being said, next steps, again, we had an ACRES advisory committee group scheduled. I believe it was the end of September, or excuse me, end of June. we did cancel that. We will go ahead and get that rescheduled, hopefully again in the next couple of weeks or so. The core team is meeting today, and so following that meeting, we'll reach back out. But we also, again, with the fast track with CMS, there was again a lot of deliverables in terms of questions and kind of crossing the T's and dotting the I's there. So we wanted to hold off until we received the official approval and make sure that nothing was changing. So again, nothing, no alarming changes in the standard terms and conditions that we received. Our implementation planning timeframe is a little shorter than we had hoped for. So in terms of next steps, just to keep my dates here in line, our implementation plan is due to CMS at the end of October. So that's October 30th. We have 120 days to complete that. And then we will have monitoring protocols that are due to CMS the end of November. And then we'll have our reinvestment plan and our evaluation design due at the end of the year, end of December. So those are the timeframes that we're looking at moving forward. Again, we had hoped that we would have 6 months implementation planning. As we're all aware, this crosses several departments and systems, and so. But that's, again, we'll convene today to discuss that timeline and pull and move forward again with the governance structure and planning process. And so hope to get you some more information after that.
So does that
we are
change,
working. Oh,
sorry, does that change the go live date, maybe?
That's, I think, still to be discussed too,
Okay.
Steve. I don't think it will, honestly. I think, the tentative go live that we're discussing is still July. But I think on the broader conversation, as well, is we're looking at overall timelines for all of Team Kentucky. So SUD, SMI, how are things going to overlap? How do they intersect? All of those, again, are going to have the same deliverables due. And so, again, I think we're trying to look at the high level picture and kind of what that roadmap is going to look like and how we roll out. And so most of you are probably aware as well, there's the 1915I, SMI, and SUD services. And so again, there's a lot that we'll be rolling out. We're really just trying to get that high level picture. And again, knowing that reentry is different than some of those services, but they are going to overlap and intersect. So as of right now, that is still the go live that we're looking at.
Yeah, and Angela, I asked that question because Van and I were on a meeting, was it last week, Van, where with the Kentucky Judicial Commission on Mental Health, I think it was a community response, and they talked about this thing, this waiver and the possibility, and there was a discussion of when it would go live, and we shared the July 1 date, and maybe sooner, always pushing sooner, but regardless, but there were some folks at the meeting who thought once CMS approves it, you can start it immediately. And we expressed, no, there's other steps. And we spent 5-10 minutes discussing that process. And I think this information helps Van and I at the next meeting, because it was the chair of that meeting, who is really his healthcare attorney, thought it would be, as soon as it's approved, we're doing it. And I said, no, there's other steps. Right, Van?
Yeah, working on that original SUD waiver back in 2017, I learned how nothing is uncomplicated when it comes to CMS.
Right.
And everything takes more time than you think it should.
Yeah. So just so you know, Angela, that conversation did take place.
Appreciate that. And we're also working on getting a one-page or some FAQs to get posted to the website as well, but also for you all to be able to share that. Because agreed. And I think in our conversations, we tried to be very transparent about that in the beginning. It is exciting. There's approval, but then there are X, Y, and Z steps to still that the state's required to take before we can actually implement. So we are working on that, hopefully in the next few days to be able to get those approved. We can get those posted and then send those to all the TACs, as well as, again, feel free to share them in other areas also. So we'll try to get those out as widely as we can.
Okay, great. Any questions for Medicaid?
Thanks, Angela. We look forward to working on this
Yeah,
for the next
exciting.
12 months. Make
Yeah.
it happen.
Yeah.
Thank you. Thank you. And sorry, I will say one more thing. I know we've mentioned it in other meetings, but also, again, looking at the Consolidations Appropriations Act and those requirements, and again, how they're going to align. There is an effective date for states to meet that requirement, January 1st of 2025. And again, really kind of still seeking that guidance. What does that mean for states? How's that going to play into our reentry planning and timeline? And again, so that's part of the discussions, and you'll hear in work groups as we move forward also. So want to put that out there, that if you all are hearing anything about that or have any questions, I think we have questions too. But again, that is going to be rolling out. We'll need to roll that out and implement and meet those requirements as we work through the reentry demonstration also.
Can you briefly summarize what may have to happen with that? Or what the objective appears to be, maybe?
Mm-hmm. So high level, and again, I think there's still we have asked, and it's not just Kentucky, it's all state have asked to CMS, and I think that they are also still trying to navigate in terms of what their requirements are. There is the mandatory section that does require the EPSDT services 30 days pre-release. And then again, also targeted case management services, 30-day pre-release, 30 days post-release. And so what we are, and that's for the adjudicated youth, again, their definition is individuals that are 21 and under, or excuse me, are under 21. So that population is going to be in a variety of carceral settings across the state. And so, again, we're also trying to get clarity, and there is some language in the standard terms and conditions of the reentry that the reentry demonstration meets components of those requirements, but still trying to navigate in terms of what the state will be required to submit, because again, those are the CAA would be state plan services. And so how, again, with the overlapping, when they mentioned targeted case management, but the reentry demonstration, again, requires case management. And if that's implemented at 60 days, we're exceeding the
Right.
the CAA. So still navigating some of those
Okay.
items.
And this may impact some folks who are in local jails, right?
Yes.
Under age 21. So, because the 1115 right now we're looking at is going to be state facilities, but this is an access point to local jails. We've had some discussions about that. So that population only. Less than, I don't know how many people that would be, but it's a different place as well, right?
Right. So those discussions will occur along with reentry, the demonstration.
All right. Sounds like you're good at juggling.
I think we can all add that to our resume these days. Never thought that would be the case, but absolutely. Yes.
Very good. All right. I keep hepatitis C on this thing because we had that discussion earlier. You've indicated previously that there's discussions internally, what can be done, or how can we go on from there. So anything to report on that?
No, I think again, trying to incorporate that into the implementation planning when we're discussing assessments, screenings, et cetera. And then again, when we're looking at, what are the gaps and what are the needs and what are the funding streams to support, as we mentioned, things that aren't currently covered under the demonstration, but as we move along in the interim until we do amend and grow, how we can meet those needs. So I think that's part of the implementation planning. Do want to mention, and let me pull it up here if you give me just a moment. There was some conversation, and we need to follow back up, that there were some entities within and groups within Kentucky that might have applied for. There was a HRSA PIN grant opportunity that closed, I believe, last month. And so again, there is the grant opportunity, I think, was up to $1 million for each of the healthcare centers that applied and are approved. But again, it was to target individuals. They were for adults, but that are in carceral settings. Community health centers, yes. Our primary care clinics, our FQHCs, et cetera, were eligible to apply. But again, it would be able to coordinate with the carceral settings that they can provide services. And again, part of that was preventive screening, diagnosis, and treating hepatitis C, HIV, and other infectious disease as a part of that. So I think we did have some programs in Kentucky apply for that. And again, it's another opportunity that as we work through implementation planning, we can coordinate opportunities to support the needs and funding for services.
It sounds like it's getting some traction in a variety of places, which is good to hear.
Right. Yes. So yes, again, and it's an opportunity that for the services that we currently can't cover pre-release up to that 60 days, that we can still support and provide support to our carceral facilities in their systems as well, as we move along and amend and continue to grow. But
Exciting. Good news. Any questions, folks? So, Marcy Timmerman pointed out, state prisoners, local jails is complex. And Van answered her, but everyone, it's a good point, Marcy, that at some point we have to get there. It's just, I don't know if we're even doing baby steps really yet, but we got to start somewhere and move forward. So
it would be really complicated to work this out with 76 full service jails all at one time. But
yeah.
I think we will get there, won't we?
We will. And again, I think building the infrastructure, our systems alignment is going to be key. So that if we can do that, integrate systems in our health exchange and access, I think if we can do that in the beginning and have that infrastructure to build on, bringing in the jails, which is very complex, I think is going to be very helpful for us to do so.
Yeah. And as we become better at it, those implementation things sometimes become easier. So
right. And again, now that CMS does have the more fast track, I think, approval process, that We have, again, when we move through this initial implementation planning, we have our readiness assessments already defined. We have our systems. And like you said, once we, I think, get through the initial implementation planning, adding and amending, and having that fast track option that states haven't had before, it's not the typical wait 6, 8, 12 months or more. So I think, again, that's also very beneficial for states.
I have a quick question,
Mhm.
if that's okay.
Yeah, go ahead, Courtney.
This is Courtney from Aetna. And this may have been covered. I wasn't at the last meeting. So have there been jails identified that are targets for this? Because I know going statewide would be a big ask. So I just didn't know if that had been decided, like where things are getting started or what region.
Thanks, Courtney. So the initial approval, again, only includes our state prisons and our youth development centers for our DJJ population. So again, we will begin with those carceral settings and then amend the demonstration once we get it implemented with these facilities. And so we can add jails at a later time to do so.
Yeah. So it's really Department of Corrections facilities, right? And DJJ facilities now. And then the local jails will move forward. But we're all paying attention to that, Courtney. It's a good question.
Yes, yes. And again, it will add a little complexity. Nothing can be easy with the CAA requirements, and again,
The CAA requires local jails now. Well, January 1, right?
right. It will based on the eligibility, their definition of eligible juvenile. So again,
Right.
I think they do define it as an eligible juvenile, but their age for that juvenile is
Less than 20.
yeah. So
And I suspect we're all figuring out how many people that is to start with. But yeah, it's still going to be something, right? Other questions? Billy Hodge has one in the comments, the service being provided prior to inmate release. What will this look like for the providers when billing for these services? Currently, providers still struggle with knowing who is responsible for the bill.
yeah. Hi, Billy, again. So what we have proposed at this time under the initial approval is that the correctional facilities will act as the provider. So again, it is a small benefit package to start with. It can and will likely look different as we amend and grow. But so for instance, DOC, Department for Corrections, and the state prisons, they would act as the provider. For instance, for the medication assisted treatment services, they would actually be billing Medicaid for those services 60 days prior to release. They again may contract with community providers to provide those services for them, but they again would actually be the billing provider in this instance. Same for DJJ. And so, and then again, part of the emphasis is on that case management service, to coordinate, identify what the needs are, coordinate those needs, and again, identify those community providers for transition. And so that's again when the end of, and ensure that there's continuing coverage from that 60 days pre-release to the post-release. And so again, the community provider would be able to bill for services that they are receiving post-release, but there would not be the lapse in reinstating benefits and some of that confusion, like you mentioned, and who's billing what.
And could some of those community providers do the case management 60-day pre-release?
So the proposed right now again is the managed care organizations will be providing the enhanced case management services. And so, but because the way that we currently have targeted case management established again is behavioral health specific. The individuals, it will be all state prisoners or individuals in prisons would be eligible for that case management service, would be receiving case management services. And so again, they may not meet those definitions of targeted case management, et cetera. And so again, that's the proposed approach.
Right.
And we'll take a look as we work through the implementation planning.
And those folks are available for the targeted case management upon release could transition to that, right?
We do have to look, Steve, at the overlap.
Yeah.
In those services.
I mean, I don't want 2 case managers, obviously. That's just
right.
But at some point. All right. Good
Yep.
question. Thank you.
Mhm.
Also, and thanks, Courtney. Yes, the MCO is doing that enhanced case management. And emphasize again, Billy Hodge, emphasize that the release info needs to be updated with DMS. So things are current, but hopefully with the 60-day, we have some better idea when that happens. And is your question, Billy, related to Medicaid eligibility upon release?
It comes back to the billing of, and if any services are provided prior to release, and who's going to pay that bill? Is it going to be the MCO or DMS or the jail themselves, that kind of thing? Because as you guys know, we struggle as the provider on inmate billing.
Right. Agreed. And so I think that that's really through implementation planning what we are to map out, Billy, and be able to show to CMS that we have that plan. That again, 60 days pre-release. So some states, again, there might be an eligibility code that's added, for instance. And so when 60 days pre-release, their Medicaid eligibility is turned back on, if you will, it turns it back on for that select service package. And then again, there has to be that process and protocol that we then, at time that they're released, introduce the new code, if you will, eligibility code, that they have then access to their full state plan benefits. So their eligibility is turned back on. It is then again mapping out their benefit package, if you will, that pre-release to at the time they're released. Right. So hopefully again, that will be the key piece, I think, Billy, like you said, is at that point, making sure at time of release, their service package is they have access to their then full state plan benefits, but their eligibility would have already been reinstated.
Yeah. And that could happen automatically without the DCBS communication. I mean, now we've lost some people with, getting to their office or something. So good questions.
Thank you.
Courtney Ham, will there be any trainings provided at MCOs? I would assume that answer is yes.
Yes. So right, correct. The MCOs again will.
Can I clarify? Sorry.
Yeah.
Go ahead.
Sorry, I just need to clarify. I guess what I mean is that if MCO case manager isn't really super familiar with DOC reentry, like kind of that process, I didn't know if DOC was going to do any trainings about their process and things like that. Just because it's nitty gritty, it's inside baseball here in this meeting, but not necessarily to a case manager who suddenly gets, a bunch of people. So I just didn't know if that kind of training was going to be provided.
Courtney, that's correct. So the managed care organizations are included in the governance structure in terms of, again, completing the implementation planning process. And so all of the managed care organizations will be included on the work groups. And so there are certain work groups around the process, and protocols. And then again, there are trainings that will have to happen among the MCOs and DOC and DJJ staff. So what are those needs? And so again, those different work groups will be working on those. MCOs are a part of that. And that again all goes into and feeds into the implementation plan. So there is an implementation plan, and again, planning period. And so that will be our plan that we submit to CMS on how we're going to roll it out. And then they will approve that before we actually re-roll that out. So then that's when we take that plan and put it into action. And so those training needs identified, system changes identified, et cetera, that at that point, that's where we have that time period before go live that we're again begin to implement the plan.
Other questions, folks? All right. We'll give Angela a chance to catch her breath, I think. Thank you for that. Good information. Exciting.
No worries. Again, sometimes make it a little too, it is very complex. So we appreciate the questions and staying tuned and working through it with us. It is a process. All of these demonstrations are. So, and that's what they are. It is going to be a work in progress. So thank you.
And really the demonstration focus is, this is an idea that we want to see if it works or not, right? More or less.
Right. We have an opportunity, approval over 5 years, to monitor, report, to implement, monitor, and report. We can make changes. We can make amendments as we move along. So, and we are, again, not held to amending the demonstration until we get through demonstration year 5. We can amend and request an amendment at any time. And again, there's the process for doing that. That in itself takes some time. But yes, we're not held to waiting until the end of 5 years. And so again, there are the set demonstrations such as reentry, SUD, SMI. But then there are also other components of things that the state can request under 1115 demonstrations. And so again, it does ebb and flow some, but we do have a large task ahead of us when we do receive the full extension in terms of the plans and monitoring, and which is exciting. But it also gives us the opportunity to streamline, make some of those changes that we've have discussed, certainly on the SUD side as well. But
an example of the amendment 2 years out or some period of time could be the local jail piece, right?
yes, local jails adding additional services to the service package. Yes.
All right, very good. Appreciate that. Any other questions? All right, let's go on to MCO updates. I change the sequence every time, just see people are paying attention. Aetna.
Hi there, this
Yeah,
is Joy
you,
Barney.
Okay, yeah, hey, Joy.
Hey, from Aetna Better Health of Kentucky. And on May the 20th, we had the Louisville Family Justice Advocates in partnership with Kentucky Youth Advocates and Save the Children in collaboration with Aetna participated in an action planning sessions on how communities can support families with incarcerated loved ones. we really did explore ways to advocate for policy changes, learn about resources throughout Kentucky, and how the participants, there were community partners, there was the law enforcement that was there, how to really support the community and families in this. And they had it at the Yes Arts Building. And so they really talked about how art making, how you can really blend that into your advocacy work. So that was an action planning meeting, and we're going to have a follow-up to that next week. So that it was a really good meeting. So, and I don't know if anybody else, I don't know if Stacy Brewer has anything else to add for it.
Thank you, Joy.
No, this is Stacy, and I don't have anything to add. Thank you, Joy, for those updates.
Okay. Great, thanks. Anthem?
Hi, Steve. This is David Crowley with Anthem. We continue to have our expungement workshops in the community. Kind of varies by region when those are held and located. We've had about 2 new enrollees that were released and engaged in case management since our last meeting. And that's about all the updates for Anthem.
Okay. Humana?
Hey, this is Jeff Hadley with Humana. Yeah, we just wanted to report out on some of our activities, focused our reentry individuals. We've been doing regular on-site visits at the Brady Center and the Healing Place, as well as several of the reentry councils, the monthly Hopkinsville chapter of Western Kentucky Reentry Council, and the Healthy Reentry Council meetings hosted by Kentucky Voices of Health, as well as the release classes that are conducted at Rotorua Correctional, Kentucky State Reformatory, and Luther Luckett. The Greater Louisville Reentry Councils, Bluegrass Reentry Council meetings in Richmond, Kentucky, Community Impact Council for Reentry in Frankfort, Healthy Reentry Coalitions, Goodwill in Elizabethtown. And we've got on it slated for our attendance is the expungement clinic coming up on July 17th at the Recovery Resource Club in Henderson, Kentucky. And that's a little bit of what we are doing to be able to position ourselves so that when we do launch, we have the relationships that we need to execute. And that's all.
Very good. Thank you. Yeah. It's getting a lot more attention these days. That's good to hear. Passport by Melina.
Hi, this is Stephanie Stone from Passport. In June, we had 6 events that we participated in or were part of across the state that were expungement clinics, reentry councils, pre-release classes, a little bit of everything among those 6 events in June. So far in July, we have 2 expungement fairs scheduled at our one-stop help centers in Hazard and Owensboro. And then we'll be participating in the Goodwill expungement fair as well. And as far as case management goes, after we all kind of let Marty know that we had no referrals at our last meeting with her, we got 7 referrals in June that were 4 members released from February to May. So catching up on those and working to engage those members. We've also created our own report that our case management team gets on a monthly basis of members that have been released and are reentering. So outside of the referrals that we're getting through the reentry pilot, we are trying to proactively engage members ourselves, so that, again, as Jeff was saying from Humana, that we want to make sure that we are very well versed in working with this population and preparing for 2025 when we implement the waiver, but also it's just the right thing to do. So hoping to be able to reach more individuals and help them with that transition.
Very good. Excellent. Thank you, Stephanie. Any questions? All right, United.
Hi, good morning, Steve. Stephanie Koenig. Our updates, we also have been participating in the reentry councils, 3 different since the last report out. And similar to Passport, we developed an internal reporting off the eligibility file. So we are trying to do proactive outreach. So from a case management perspective, since over the course of 2024, we've only received 3 referrals through that pilot with DOC, but within our internal reporting, identifying those that have been released, our internal outreach efforts beginning in February, we've been able to contact or outreach 800 members, 133 were reached. We completed 101 HRAs, and 66 of those individuals were agreeable to case management. So we are looking at that on a monthly basis and making those outreach calls to engage them into services and preparation. Also for the implementation of the reentry waiver.
Right. Very good. And WellCare.
Good morning to you, Steve. So speaking of county jails, we have these, we call them community impact councils, where basically we kind of assemble community leaders, stakeholders, and to identify a given safety net, social safety net issue gap, if you will. And so we created one for reentry last fall for Franklin County. And so a community impact council. And so it really is heated up this year. One thing that's really cool is we have several other plans, several other MCOs that are on the council have been attending the meetings, which we really appreciate. And so anyway, the whole target has been Franklin County jails. And so one of the things that we've discovered is that unlike, like if you're in the state system corrections and you get released, you get resources. You literally have, I think it's like a front and back, all these different numbers, community resources, housing, transportation, healthcare, everything. You get all these resources to at least start you on your way. But for most, in fact, very few, I think actually county jails, do you get anything like that? And part of it is I think they're just so busy, like trying to process, because it's shorter stays. And so the staff's kind of overwhelmed just getting people in and out. But anyway, so there's some wonderful stakeholders on this council in Franklin County. And one thing they point out, Madison County actually gives their, when individuals get released, a lot of stuff. And they even get referred to housing. They get like kind of a toiletry kit and other things as well. So anyway, that's what this group has been trying to collaborate to brainstorm. And one of the needs they've identified is sponsoring state ID cards, because you don't have an ID, you can't do anything. And WellCare and other plans offer a state ID card as a value-added benefit, but that's if you're enrolled with us. That's not just for anybody. So we're talking about anybody walking out the door. So that's one of the things they've identified. And also just who all, there are resources available like in Franklin County, but when you leave, you're not given anything to point you in the direction. So been trying to figure out how best to assemble that and who all to give it to. And, like one of the things that the council has talked about is attorneys, obviously the member and family members, but attorneys, case managers, anybody who's going to touch the individual. And the jails themselves are too busy. Really, they don't have the time like to sit down and do that, they've discovered. But anyway, that's been a key focus of the group. And Laura Vessels, I think, is on the call. She's the one that heads it up for WellCare. So Laura, if you've got anything you want to say, please feel free to jump in.
Stuart, I think you did a great job summarizing. I think those 3 key plans of action that I see with this group is that creating a program to address the identification cards and maintaining benefits. They are looking at implementing a peer support reentry program, focus on long-term recovery for those exiting incarceration. And they're also looking at reentry program models across the state and other counties. So various counties, Stuart mentioned Madison, they're looking at Boyd. So just looking at different models for jail systems for assisting those who are exiting incarceration. And that was all that I wanted to add.
Yeah, and there were, if I recall, I think with opioid abatement funds, I think there's a peer support specialist in the Franklin County Jail now, or plan to be anyway, that would actually work there. I think that was
That's part of the conversation that they're having, yes.
okay, all right, yeah.
That'd be good.
And I think, they're talking about the need is for, like this initiative right here, substance use treatment while you're in the jail. And that's obviously a critical need that's been, I think, mentioned for Franklin County, probably the county jails anyway. So, which again, it's fantastic that all the work that DMS has done to get approval of this waiver.
Yeah. Yeah. And that ID card, I know a lot of people who have lost their social security card, lost their ID card, and, they're trying to get a job and, they have enough challenges already and not be able to just pull that out and show it. It's, they're all waiting to get those things. So,
yeah, you need it for everything.
mm-hmm. All right. Any questions? Thank you, WellCare. Round robin member updates. There's 2 other members on here. I put down Medicaid eligibility post-release as an ongoing topic. I have not heard great concerns about that recently, but I just like to keep it up there. Legislative updates, implementation of some bills. There's nothing really to report for me from that. And I just want this group to know that the Kentucky Judicial Commission on Mental Health is also substance abuse and intellectual development disabilities. They have a reentry work group. If I can send that out. If you're interested in when that meets, let me know. We can do that. And I'll put my email, or if you can share my email, if you have it, in the chat, maybe Marcy can do that, just so folks have that. Yeah, we'll send that out. It's a worthwhile group, and obviously reentry is getting a lot more attention than it has previously. I've heard a lot of talk about it, not a lot of work around it. So, but anyway, Van, do you have anything you want to share? Thank you, Marcy.
A couple of quick things. Tune in today at 12:30 for Team Kentucky, and Governor Beshear will announce 4 more communities that are going to be have been certified as recovery ready. They are Lee County, Nelson, Breathitt, and Jessamine. That brings us to a total of 14 counties designated as recovery ready, and that covers about 25% of our population. Really proud of that program. In 18 months to be able to cover 25% of Kentucky's population. And we anticipate at the end of August, 4 more counties at least will come on as certified as recovery ready, including our second largest.
What that really means, recovery ready?
Yeah, it really takes a look at what a community has done to support people in recovery, and that they're scored on categories of prevention, as well as treatment and recovery resources. If you go to www.rrcky.org, that's the website run by Volunteers of America Mid-States that run that program with us, and see what it takes to become a recovery ready community. It is an exhaustive list of things that a community has to meet. So I really believe we have to have grassroots efforts, or we're never going to get out of this addiction crisis we're in. And a lot of our communities are recognizing that. Yeah. The only other thing I'll mention is a save the date for September 16th. We hope to have our Recovery Month celebration that day on the lawn between the Capitol Annex and the Capitol. Probably going to start about 10 o'clock that morning, but we'll put a flyer together when we get this firmed up at the end of the week and get that out.
Super. It is really fascinating, right, Van? You've been at this a long time, that communities are willing to become a recovery ready community, where you go back 10 years ago, no one wanted to talk about it.
That's correct, Steve. They get no incentive for doing this other than the bragging rights of being a recovery ready community. And we've got another 8 in the application process right now. So So, and you're right, 10 or 15 years ago, nobody wanted to talk about it. So we've come a long ways.
Yeah. Some progress every now and again is nice to report. So
yeah.
We're working on the application for Floyd County right now, and it's not easy, I'll tell you.
Well, good. Well, maybe Van can help you.
We'll get you some technical assistance if you need it.
Yeah.
We have a VOA member that attends our meetings, so she's been helping. We hope to have it submitted by the first week of August.
Nice.
Good deal.
Good deal. Congratulations, Casey. In Floyd County. All right. I always have future agenda items, and we have no recommendations, except we do appreciate the great work Medicaid's done getting us where we're at today and looking forward to opportunities. And our next meeting is September 12th, 9 a.m.
Well, and again, I think we'll add to that, Steve. We appreciate the support, but again, it hasn't been all Medicaid by any means.
Right.
So certainly lots of partners involved, and again, continue to say the scope of this project. And again, it's not just Kentucky, or Medicaid, but again, it crosses many departments and systems and agencies and our
cabinets,
communities. And
yeah.
right. And it's,
yeah.
And it's, again, just continue to say the 11-15 demonstrations are just part of, the broader state initiative. So we appreciate the work everybody has also put into it and support and hanging in there with us. So
yeah. Very good. All right. Y'all take care. Nothing else. We're done. See you.
Thank you.
Thank you all.
Have a great day.
You too. Bye-bye.